welcome everyone. I am super excited to be here today with Tim Gaffney. Am I saying that right? Gaffney?
Gaffney, yeah.
Gaffney, I got it right. I'm super excited to be here today with Mr. Tim Gaffney on behalf of Touchpoint Medical, who's going to come and share with us some information all about, different ways that we can actually improve patient healthcare access, which we know has been a huge area of opportunity pre-pandemic, and it definitely exploded when we got to the pandemic. My name is Dr. Nicole Thomas. I am a registered nurse and the founder of Impact Nurse Consulting. And today we do have Mr. Tim Gaffney. Just a little bit about Mr. Tim Gaffney. In 1994, Tim founded what is now Seamless Point of Care, which is a division of IRG of Georgia LLC. Starting as a humble low voltage cabling company, it grew into a dental technology integration firm with over 250 dental clients. In 2005, Tim sold his dental client base to focus on acute and ambulatory healthcare IT market. Today, Seamless Point of Care is one of the leading healthcare IT integration companies in the nation. Right? So not just where he currently is living, in the nation. As a managing partner, Tim's responsibilities include development and execution of corporate strategy and cultivating strategic partnerships with clients and vendors. He is committed to providing the very best working environment and relationships for Seamless Point of Care team of employees and clients they serve. He currently serves as senior micro healthcare IT and Pro AV advisory councils. He is a frequent lecturer on healthcare IT, point of care challenges and solutions. Tim is a U.S. Navy veteran. Thank you for your service, Tim. And lives in Brevard, North Carolina with his wife, Corey, and their 2 children. He enjoys fishing, canoeing, mountain biking, guitar picking, and mountain living. Welcome, Tim. I'm super excited to be talking to you today. How are you?
I'm good.
Yes.
And I do want to clear up just one thing on that bio. We do operate in a national basis when it comes to working with a company like Touchpoint, because we like to, just when we were, ICW is one of the companies that has been purchased by Touchpoint. Okay. And we've always been very involved on a national scale, working with them and helping other reps and clients all collaborate. We collaborate together. And it's the same thing with Touchpoint. We're more based regionally in the Southeast, but we're here to help people across the nation any way we can that are in our network.
Love it. So I know I read your bio and we got to learn a lot of amazing things about you. What is something else that maybe is not in there that you want to make sure that people know about you, and just your background and the value that you've been bringing to the marketplace? Because you've been doing a lot in the IT field, which is awesome.
I think probably the biggest thing is my company, we don't just focus on, a couple of products. We go in, like, I'll give you an example. We're working with Emory Healthcare here in Atlanta. They're a great customer of ours. And our teams are out there right now doing an installation. It's a 17-story cancer center, brand new. We started on this project about 2 years ago. And we also install all the patient TVs, tracking boards. We're installing every computer and printer in the place.
Wow.
And so pretty much if it's technology-based, hemodynamics, everything, some of the AV, we do it all. So we're able to go in and work with the health system and provide a sort of a one-stop shop. I always think of the name like Touchpoint Med. We literally touch, medical at all points.
Yeah.
So that's a little sales thing for them.
Yes, I love it. So this definitely segues into the first question that I have for you. So when you hear the term improve patient access, right? How can we improve patient access? I know it's been a quote unquote buzzword for many years, but it's really something that is at the forefront of healthcare. What comes to your mind when you hear improving patient access?
Well, I made some notes because I wanted to make sure I kind of got this covered. So I'm going to read from this.
Yeah, please.
But just to make sure I don't forget anything. I mean, the first thing, when I think about access, and I've been doing healthcare for a long time. So I'm in and out of hospitals, doctor's offices, outpatient facilities every week. And I see, one of the biggest things, I also happen to have sisters that are in healthcare and LPNs, RNs, and the things that we talk about. There's a lack of providers. Is the first thing. We're running out of nurses. You know that, and yes. the aging nursing population. There are patients having to travel. It's a big obstacle for people. I see it at one of the hospitals that we're working in Atlanta. The transportation services are breaking down. Which means that telemedicine can play a bigger role in a lot of ways. So obviously higher cost. Another thing is a language barrier. Yeah. I was at a hospital the other day, and as someone was walking in and trying to explain in was a Far Eastern language to this front desk person that this wasn't an emergency and they were supposed to see this one doctor. Well, obviously, the person right up front could not understand a word they were saying. And so they called for a translator, and they bring up basically an iPad on a stick, and they can translate and do this. Those are sort of some of the, even like we've created some of those products with ICW to make that happen. So there's a lot of barriers to that. And one of the things that I see too, and I know that this is more on a macro level, but too many specialists and not enough GPs.
Yes, I definitely agree. Definitely agree with you on that one.
And we're going to have to do something in this country about our willingness to train more nurses and technicians and PAs, doctors, create a vision for people so that they can go out and have the ability, no matter their, if you're smart and you're willing to work hard, doesn't matter where you come from. Let's give people an opportunity.
Absolutely. And, just to piggyback off of that, Tim, it just makes me think of the role of nurse practitioners and how their scopes, there's really a huge opportunity for them to start practicing at the top ability of their scope. And a lot of states, unfortunately, still not have adopted full practice authority, which does limit the availability of that primary care provider who is highly skilled and trained to be able to do that. So I definitely agree with you on that. So as a person who's been, in the IT field, in the health world, in the healthcare technology world, in and out, seeing how everything goes, what are some of the biggest obstacles that you have witnessed that actually impede patient access? Now, I know you just talked about a little bit of those in your previous question, but what are some other things that you may see the biggest obstacles that really is like, listen, this is something that we need to address now because it's really stopping the flow of patients having access?
I think some of the things that I just spoke of, obviously higher cost. Yeah. Higher cost is I'm going as an owner of a business who provides insurance for my employees. When I get a call from my buddy who is my healthcare insurance provider, and he tells me nonchalantly, "Hey man, sorry, but your rate's going up 18% this year." It's unsustainable for small businesses, and then but at the same time, in order to attract the right people and keep the people that you have, you have to do it. So you have to find other ways to be creative. Well, we're lucky we can do that. There's a lot of people that just can't do it. They can't afford it. And so a lot of folks will fall through the cracks. I grew up in a very rural environment in times of my life and grew up where we didn't have a whole lot. And access was, for us, access was always a publicly provided doctor, dentist, whatever. So I'm really sensitive to that. And I just don't see, I know it's out there. I know that there could be a lot more clinics that are provided that could provide, instead of having to walk into an emergency room and clutter up emergency access, there should be clinics in local neighborhoods. Mm-hmm. And we should have more local clinics that are available to people, not only providing them health care when they need it, but preventative measures for people.
Yes, absolutely.
Inside those communities. It's almost like, you go inside of a community and you see so many food deserts where there aren't enough healthy places, more available healthy food, more available access to medical care, but also preventative care at the local level. And technology, like everything that Touchpoint provides, that we provide, this is not stuff that when you compare it to the cost of some of the software they have to use and other things, it's still a bargain. So there's a lot that can be done by providing more access locally, and with the people, providing jobs for the people that are in the community, that know the community, and create this at that very local level. I think that's paramount.
Yeah. And I agree with you. And definitely what you said, it's just that domino effect, the example that you started with businesses that are unable to sustain the cost to provide medical insurance to employees. So now what does that do? That impedes them and their families who they're responsible for now having limited access to the health care, especially simple preventative health care that they really and truly need. And then also the implementation and more resources going into things like FQHCs, which are federally qualified healthcare centers that really go off of sliding scale that ultimately increases access not only to physical health, but also mental health, also behavioral health. So, all of those other different elements that makes this one conglomerate of a healthy being. And so absolutely, I definitely see that as being a big point, a big obstacle when we talk about access to healthcare, the cost, because it does cost and somebody has to pay the bill somewhere, right? So that's absolutely something that I can agree with you on. So just to shift just a little bit, in today's world, innovation is all around us. There is not one thing that we can talk about even 5 years ago that is probably the same. It has definitely innovated in some manner. And with that, it still seems that sometimes when it comes to the healthcare industry, we're still trying to identify and find our place on the most effective and impactful ways that we can innovate within the healthcare space so that we can improve, the delivery as a whole. So with that, what are 2 to 3 recommendations that you have for healthcare organizations, providers, those different clients that you work with on a daily basis that they should keep in mind when they're seeking to innovate? Because, a lot of healthcare systems are really and truly looking to innovate. They know it's there, but they're like, it's so much. Where do I even start? What are the top 2 to 3 things they should start with?
I have a lot of opinions on this, but one of the ones I'll give you is, going through the pandemic and being in healthcare, we think about the need, and the next big need that we have in healthcare is just around the corner. And we learned a lot as a technology company going through this, working in those environments, whether it was, acquiring PPE, whether it was staffing needs. One of the things that I wrote down that we learned a lot about what I call net inefficiencies. Like you can throw all of these at, you can hire all these traveling nurses. You can bring everybody in. You can pay the highest price for the PPE. And you can bring all that together. And some of the outcomes they're doing their absolute best. And some of the outcomes that we saw were still very sad. And one of the things that think about, can I give a few examples? Because I think that's the best way to do it. So one of the things that we saw happen was we saw people going into a hospital with a lot of times with comorbidities and with COVID, and they're going in, and just like that, they're locked away from their family. And these people were dying, and their family had no way to talk to them, say goodbye. So what a lot of the hospital systems realized is that we got to have a way that these patients can connect with their families. So what we provided, and this was done by some of my colleagues around the country too, is we provided these simple cart solutions that allowed, again, think of it as almost like a telemedicine where you have a cart, you have an iPad, and that patient can be there, whether or not they're ventilated or not, to have a family member to be able to see what's going on with them, and the ones that weren't, to have some communication. And those were created quickly and sold by the hundreds of thousands to get those out, maybe not that many, but to get them out into the field. That was one great solution so that family members could communicate. Another thing that we saw and that we helped to collaborate with ICW, with Cisco, and with another computer and HCA Hospital Systems, is we created some of the first patient sitter carts, technology carts. So imagine if my mother's in the hospital, okay, and I don't have the ability because I have to work and I have things to do, and she doesn't have she has a couple of daughters and her son, and they're all incredibly busy. We try to sit with her and stay with her as much as we can, but when we can't, hospitals have to come out and pay sitters to sit with those patients if they're fall risk, things like that. Mostly elderly patients. So we provided a virtual patient observation system that included a cart that went in. And this was a collaboration with Seamless and ICW that would allow for a wireless access and a camera up here that could always have communication with the nurse and the patient. So now the actual camera could monitor up to 4 people. So that person that's monitoring those 4 patients could be in the hospital system, could be in Texas, or could be in India. But they were monitoring these patients virtually, able to save the hospital money. And if there was an alarm where someone was about to get off the bed, they would say, okay, they would hit a button, and basically the nurse is notified. They go in, save the patient from falling. So things like that came out of COVID. Some of those the sitter cart came before COVID, but was instrumental also, along with that first thing that we talked about. One of the other things that is needed supplies in this industry, mm-hmm, the availability to get, of course, there was the whole thing with PPE and some of those items, like especially infection control devices, right, the misters, and all of the things that you need to have in a hospital system today. But a lot of times with some of the newer projects that we've been working on, these new towers, CHOA, Children's Hospital of Atlanta, Emory Tower, they were pre-buying products 2 years in advance because they had to know that they would have it. And I think that more and more hospital systems are looking at this and thinking ahead about what do we not what we need right now, what do we need down the road? And let's plan for this and build for this. And so that collaboration between between everybody on the healthcare team, mm-hmm, from top to bottom, and with technology companies, with Epic, with Cerner, all of these people working together, and really importantly, with patients.
Yes.
Patients involved. Patients have to be part of the solution. Mm. But if you bring all those people together, you can create a path, I think, to what the hospital is going to need, not just today, but a couple years down the road, a 5-year plan. One of the jobs that we're doing at CHOA Hospital, we've been working on this project for 4 years. It started off, as there's an incredible vision for the largest children's hospital in the country when it's done. They created a cardboard city. Imagine a huge warehouse of cardboard, a whole hospital floor. That goes to a demo, what they call the bike shop. They bought an old bike shop and they created these phenomenal demo rooms, virtual rooms, so they could walk everybody from donors to patient collaborators, and they would say, yes, we think that's a good idea. No, I don't think we should put the family TV. I could never see myself sitting here on a couch looking that way at a TV. I need to be able, all of these things matter. Bringing patients into healthcare to help them have a say is absolute key.
I love that. I love that. I love it. I love it. I love it. And you're absolutely right. So with that, one of the things that you talked about that was really, intrigued my interest is the sitter cart. Mm-hmm. So I know that those were things that were developed for COVID. How are those things still being utilized now, quote unquote, post-COVID, to even just help with improving access for right now for healthcare? Are those things that healthcare organizations should even look to for now, outside of COVID that can help them?
Yeah, I mean, and again, the first sitter carts were developed. We put the first ones out that we came up with in about 2016, 2017. So those were pre-COVID, and they are now becoming more and more popular because as the technology has improved, face it, there are some issues sometimes when you have a sitter. If you have a paid sitter, there can be issues with they're people, they're human beings, and things just happen. When you bring a cart in, that cart comes in, it's just going to do its job. Mm-hmm. And it sits there, it maintains a view of this patient and this bed. And then to have that connectivity from the person in the bed to the viewer that's watching the patient to the nurse's station, so they can alert the nurse that there's something going on in that room. You need to get in there right away. That's really key. It's a little triangle there that makes a big difference. And there are studies out there, and you can find this. They say hospital systems save thousands of dollars, millions of dollars a year in a big healthcare system when they go to this technology. And I think that's anything we can, these hospital systems can do. I would like to think that by improving outcomes like this and saving money, that healthcare can get less expensive, especially to those populations that are most vulnerable. We'll see.
Right. Love it. Absolutely. Absolutely. So my next question for you is, improving healthcare access has really, like we indicated, been at the forefront for several years. This is not anything that is new to us. But definitely, it's been even more of a topic post-pandemic. How do we improve access? How do we improve access? What are some of the biggest lessons learned on why the time is now to really and truly start improving patient access? Why should we not delay anymore and say, listen, let's start this right now. We've learned our lesson, right? We're coming out of this. You indicated earlier, we're just a few miles down the road from the next big event that happened. Why is the time now for healthcare organizations to start adopting some of these different type of technologies to improve patient healthcare access?
I just don't think we can, watching this for as many years as I've been involved in healthcare. And again, we started in dental first, and then from 2005 until 18 years now, we've been in acute care and clinics and stuff. Watching this whole process develop, we have just seen a lot of workarounds.
Yes, there
has been a ton of workarounds that hospitals have had to patch here, patch there, make do here, make do there. And again, with the availability of the products, especially when we have a lot of products that are built overseas. The truth is that I'll just say this about ICW. ICW is an American-made product that is built in Medford, Oregon. And when we had issues during COVID getting product, we never had issues getting ICW product because it was built here. And I think that's really key. And I think that's key to in looking at what's coming up next. But when you have it's availability issues, and that was the biggest issue for a technology company like ours, was just being able to get the products that we needed to deliver to our customers. We got the people, we can deliver the solutions. We had to have the products. So again, I think hospitals, healthcare systems have to be more proactive, bringing all the collaborators and all the people together, and then they have to make their minds up which systems they want to implement. You've got a lot of healthcare systems out there in my area in the Southeast that have a lot of legacy gear. Mm-hmm. This is really going to be important because back when 2008, when the crisis happened, and we threw $35 billion towards the digitization of healthcare technology. Mm-hmm. We had this word meaningful use. Yeah. Okay. And so we had the word meaningful use. So all of this money was spent, and and we built our business on this. Mm-hmm. And we went out and we worked with all kinds of people, from IT directors to all kinds of folks. But really, we were really at the IT project manager level, IT guy, IT gal, and just get it in. Let's just get it in. Whatever we can do to get meaningful use. We've all gone past that now. We've all gotten to where we threw it in there, but now it's time to get really smart about it and start thinking about the things that they absolutely have to have. Again, what I call the net inefficiencies. And so the ability to provide what is needed for the patient, and thinking about ahead of time is going to be key for us going forward, and being able to get the products that we need. Does that answer that question?
Yeah, it definitely does. Because it's important for a healthcare organization, provider's office, all of these different entities that deliver healthcare, to really and truly start thinking about the now, because the next is coming now. And by the time you start preparing for the next, we're behind the game. And so, really and truly identifying what are those big lessons learned on why the time is now to improve that patient healthcare access. So absolutely, that answers that question. So as we wrap up, Tim, any final thoughts, anything that we did not cover that you want to leave as a nugget, as a gem to healthcare organizations, to provider's office, all of these individuals that are looking to improve patient healthcare access, that you want them to take away that we did not discuss? Any final closing thoughts?
Sure. I was recently asked to do a presentation at Touchpoint, and a couple weeks ago. And one of the things that I provided in my slides was a story. And the synopsis of that story is, this is a people business. And the quick story was, I was called into a meeting for a brand new ICU, last minute meeting. And when I got there at this hospital here in Atlanta, I walked into a huge committee sitting at the desk. The committee winds up asking, where's Betty? Betty is the ICU charge nurse in charge of 30 beds. Betty winds up coming down. She's not real happy to have being pulled away from a complete census full ICU. And the exchange doesn't go well. And Betty finally looks over and says, this is seamless. The guys that did the same hospital for us right over here, I trust them. Do whatever they say. So our company had built up trust with this healthcare system that she was completely comfortable with us. When we left and we got into the elevator, someone that I was in the elevator said something pretty disagreeable about Betty, the charge nurse. Mm-hmm. Well, I started thinking about it. And if you think about everybody that Betty has to answer to, and that from the patients to the families, all the way up to the doctors, to the lawyers, everyone else that she's constantly has to think about. But the other thing about Betty is she has her own life. Mm. And that's even more important. And I tell my team members all the time, you guys have your own lives. Work is important, but family comes first. And it's the same thing when we're all working in this technology industry together. We have to remember that we want to be successful, and for our patients, we want the best outcomes. And we always have to remember to think about what that person, because healthcare can be so stressful. When you're doing sales, people are not getting back to you. You know they need you, but they just can't get back to you. And you start to think, well, they must not need us anymore, or I must have done something to make them mad. No. People are just busy. Yeah. We all have our own lives. Mm-hmm. And we remember that, and we just take care of each other. And it usually works out for the best. But we have to remember, we all have our own things going on.
Yes, I love that, Tim. Tim, it's been a joy just to talk with you on today, learn more about you and the value that you bring to the healthcare space, especially with your intense and expansive knowledge of technology and how that is used to do something that is critically important, which is to improve patient healthcare access. So I am humbled. I am grateful that I had an opportunity to spend some time with you on today. And thank you so very much for talking with me on today.
Well, thank you for asking me, and I hope you guys have a great weekend.